Dear Chair, dear guests. So one of our main interests in the pancreatic research laboratory is acute pancreatitis. Acute pancreatitis is a sudden inflammation of the pancreas. The main causes are alcohol and bile stone disease. Its severity can range from mild to severe, and especially severe form has a very high mortality. And part of this is related to the unclear pathogenesis, and also the disease has no specific therapy. So our main interests in the lab and our projects include the investigation of various inflammatory factors, mitochondria, and also our focus is on these ductal cells, which play an important part also in the pathogenesis of the disease. So some of the available most important techniques, besides the most common like molecular and enzymatic measurements, may include the induction of various pancreatitis models. This is an ornithine-induced pancreatitis. Andrea Molnár will describe this model in her presentation. We also have other pancreatitis-inducing agents like cerulean and sodium taurocholate, which you can see this is the normal pancreas, and this is the pancreas which contains a lot of inflammatory cells and also necrosis of cells. This can be also reproduced with cerulean and also sodium taurocholate. Our interest is also focused on Essener cells, so we have to isolate these cells from the pancreas, and also these ducts, which involves collagenase digestion and also a microdissection technique. Using the ducts, we have two pictures missing from here, unfortunately, for some reason. So we can use video microscopy to measure fluid secretion of these ducts. So after an overnight incubation, the pancreatic ducts seal, and with perfusing with different solutions, the volume of these ducts increase, and we can measure the rate of fluid secretion. A very difficult technique includes the microperfusion of these ducts. So through a perfusion pipette, we can perfuse the duct from the apical side and also from the basolateral side, so we can distinguish the activities of different transporters on the apical membrane and also on the basolateral membrane of these ducts. I think you've already seen some confocal images previously before. We also have a confocal microscope, and the activities of the transporters that I mentioned are measured using this inverted diaphragm microscope, and using fluorescent dye we can measure hydrogen concentration, chloride concentration, calcium concentration inside the cells. Here are some of our selected publications, and we have a wide range of collaborators throughout the world, especially in the UK, the US, and also Germany. So the pancreatic research groups, I would like to highlight three of the principal investigators, which is Professor Takács Tamás. Professor Péter Hegyi is actually has his own group now, thanks to the Hungarian Momentum grant, and of course I'm standing here. Our Szent Györgyi student joined our lab in November last year, and she's from Radnóti High School, and now she is the first-year medical student in the University of Szeged. So, Andrea, I would like to ask you to present your lecture. Thank you.
Dear audience and chairs, I would like to speak about the effects of opioids in experimental acute pancreatitis. The leading symptom in acute pancreatitis is the pain. The most important factors involved in the nerve damage, pancreatic ischemic, pressure caused by edema, release of inflammatory mediators. There are three important questions. What are the effects of the severe pain on the development of the disease? What are the effects of the analgesics of the disease? And what about in the pancreatitis? According to the WHO pain management guideline, there are the potential analgesics, non-steroid anti-inflammatory drugs used for mild pain, and opioids used for severe pain. We use the opioids. Opioids have positive or negative effects. Positive like pain relief, reduced pancreatic secretion and vasodilatation. Negative effects like paralytic loss and on-sphincter spasm. We aim to investigate the effects of major analgesics on the severity of experimental acute pancreatitis. Our methods. In our experiments, we used Sprague-Dawes, Lillard. We used the withdrawal test for determine the effects of opioids. We choose the two compounds, morphine and buprenorphine. Morphine is the partial mu agonist, delta agonist, and kappa antagonist. Morphine is mu kappa and delta agonist. We induce severe necrotizing pancreatitis with L-ornithine. The control group has got physiological saline. The laboratory and histology measurements were there. For the laboratory measurements, we measure serum amylase and pancreatic drive ratio determination, and histology for necrosis, edema, and inflammatory cell infiltration. We use Tay-Driver test for determining the effects of opioids. We put the animal's tail into hot water, and we determine the time when they draw their tail into the water. And we check different time points, 1 hour, 2 hour, and 3 hour, and something like that. Morphine relieve the pain 3 hours. Buprenorphine relieve the pain more hours, but it has a less effect compared with the morphine group. 20, but not 5 milligram per kilogram morphine reduces significantly the severity of acute pancreatitis. We measured serum amylase activity and pancreatic dry weight ratio. And there are the histology pictures. In the first picture, there is a control group. It is a healthy pancreas. The L-ornithine groups have severe necrotizing pancreatitis with inflammatory cell infiltration, and morphine-treated group, the pancreatitis severity reduced. We quantify the data. Inflammatory cell infiltration significantly reduced in 20 milligram per kilogram doses, and the necrosis significantly reduced in the same dose. Intrathecally administration of buprenorphine in the acute pancreatitis graph significantly reduced the water content of the pancreas compared to the pancreatitis group, but intraperitoneally induced buprenorphine significantly increased the severity of the pancreatitis. Intrathecally administration of buprenorphine significantly reduced the pancreatitis severity, but intraperitoneally administration of buprenorphine significantly increased the serum amylase activity. There are the histology pictures. you can see that buprenorphine-treated group have reduced severity, increased severity of pancreatitis, but intraperitoneally administration of 1 milligram per kilogram buprenorphine has a more severe pancreatitis. Centrally administered buprenorphine reduced inflammatory cell infiltration, intrathecally administration, but when we use the buprenorphine intraperitoneally, it is significantly increased the level. Now, intrathecally and intraperitoneally administration of buprenorphine significantly increased the acinar necrosis. For summary, pretreatment with peripherally administered morphine dose-dependently ameliorated the severity of acute pancreatitis. Centrally administered buprenorphine dose-dependently reduced the inflammatory cell infiltration, and peripherally administration of buprenorphine in high dose deteriorated the severity of the disease. The conclusions: different dose types and routes of opioid administration are important factor in the determining of the severity of acute pancreatitis. Opioid receptors may influence the pathogenesis of the disease, and we needed to further investigation for examine the mechanism of opioids. And thank you for your attention.